Hello, ladies and gentlemen. Welcome to Mr. Kokosness's class. So, this afternoon, we'd like to deal with the observation room as well as the emergency room. What can you do in the emergency room, or what can you do for the patient as they come in the observation room? That's what we want to look at. So, as we look at this, we'll show you what is found there, and some of the things might not be there. So, the emergency rooms or observation rooms differ, okay, depending on the hospital and the kind of equipment that hospital has. So let me take you for a ride. We see what is going on here. Okay, so this is the observation room that we have here. Okay, so in this observation room now, let's try to go inside and see what is there. Okay, so here it is. Okay, so we've got this bay here. On this bay, as you can see, there are two seats here. So meaning that you can have a patient come here and you can also sit on this chair here, put the patient there. You can do the interview or what we call history taking. So you can get history from here, or you can even write the notes from here. So this is why you can even find things like prescription pads, okay? So they can be there, so you can do the prescriptions here. Then you can have things here for the lab here, meaning these are the pads that we use for the laboratory, so you can have them there. Then you can also have maybe say referral forms, admission forms. You can have all kinds of stationery there because you'd want to refer maybe even the patient to the x-ray department, so you can have all the forms that you may need there. So it's very important that you prepare all the forms that can be used there: the x-ray forms, the scan forms, the lab forms, the prescription pads, sick notes. So you can have whatever forms you want to put there, you can have them on this bay here. So it's very important that you prepare this bay, and it has to be like that. Then let's move to the corner. The corner here, what we have, this is the hand washing facility. So you wash your hands there. There is hand washing soap. Then there is also hand washing sorry, this is a drying thing, okay, or paper towel. So you can dry your hands using paper towel, okay, after you wash your hands with soap. So you do it from there. Then what else do you have in the observation room or emergency room? You can have the sharps container, okay. So this is the sharps container. You have to make sure that it's 3/4 full and then remove it. So that's what we have there. Okay, then this is a biohazard bin. So this is where you throw all those things you're going to use on the patients, like ink sheets. You can throw swabs. You can also throw maybe cotton wool, okay, but do not throw the sharps there. Sharps should go in the sharps container, then the rest should be thrown in this bin, whatever you use on the patient. Then as we go along, I'm sure you're enjoying the ride, okay? So the ride keeps on going on, and I'm sure you're enjoying it. Then we also have what we call a drip stand, which is this long thing here, okay? This is a drip stand. So this drip stand, I'm sure most of the nurses know how to use it. You hang your fluids there. You can hang them there, okay? You can have two running at a go. So you hang them there. Then you can adjust the length of the drip stand from here, okay? So you can have it. It's very important because this is a room where you administer the fluids, okay? Then here we have also the oxygen apparatus, okay, as you can see. So you need to ensure that it's checked and you're having the oxygen inside there, okay? Then you need to have it on the trolley so that it's easy for you to move it. Then you can have a bed nicely made. So the bed should have at least maybe just a pillow and the necessary linen plus the cardiac table, okay? So you can have all those needed, okay? Then as we go along now to this other side, you can have the suction machine, which is here, okay? So you can have the suction machine because you might have patients who might come in and they might need to be suctioned. So you might have it there. Then what else can you have? You can have a cardiac monitor because some patients need to be, checked in terms of vitals. You need to check their vitals. You need to also to ensure that these patients are okay in terms of the hemodynamics, okay? So you can switch it on and do your vitals and all that. So this is functional, so you can do all the vitals here, okay? So you can try and see, but we'll talk about the use of the monitor later. but just know that you need to have it. Then you can also have a defibrillator, but you don't have it here. A defibrillator, you can have it so that at least those who are having issues with the heart, you can defibrillate them. Then what about in this corner, what can you have? You can have a cabinet or a cupboard. Okay, so this cupboard is lockable. You'd have a lockable cupboard. Okay, so in this cupboard, what should you put? So in the cupboard, you should be able to stock all different kinds of ambu-bags or bag and masks. So you can have these as ambu-bags. You can put them there so that you are able to give oxygen to those who are not maybe breathing well. You can assist them breathe or do your resuscitation. Okay, so when the airway is maybe clear, you can use them. So you can suction or remove whatever is blocking the airway, then give air using these bags and masks. So there are different types of masks that you can have here. Okay, so you can have different types of masks and tubings. So you can have your tubings, your masks, okay, then the bag and masks, so you can have them here. So you can simply call them ambi bags. So you can have them right there. So this is for the airway. So you can try and resuscitate from there, okay? Then, so as you can see here, you can stock. So even your unit, you can stock it as you like it. So, but at least ensure that you have different types of masks, then the tubings for connecting to the oxygen cylinder so that you're able to give oxygen, okay? Then you can also stock the other cabinet where you can put things like examination gloves, then you can have surgical gloves, okay, so that you're able to handle that emergency as quickly as possible without delays. Then you can also have incontinence sheets, we can put them there, okay, and you can also have maternity pads. You can have some pads there, okay, for the ladies, maybe they're bleeding and all that, having vaginal bleeding, you can place them there, okay. So you can stock this as well. You can just stock it in a manner that you feel it can be helpful as you are trying to resuscitate, okay. Then another layer here, what we have is different types of cannulae. So we can have the 20 Gs there, we can have the 23, okay, we can have the 24 G, okay, and you can have the 22. This is, sorry, it's 22, then this is 24, then the 20G. Then you can also have the 18G. You can have different types of cannulae so that you're able to cannulate the patient, okay. And then apart from having this different type of cannulae, you should be able to have strapping around. I just removed it. I need to put it back. Then you need to also have this is a salbutamol nebule, okay. So salbutamol nebule, you should have it in this cupboard because we're saying observation room stroke emergency, so that you're able to resuscitate those who are not breathing well. So you should be able to give them that nebule. Then we have lignocaine, you should be able to have it. In terms of suturing, you can use it. And those having cardiac problems, sometimes it's used, okay, for those having arrhythmias. Then you can also have aminophylline. You know that aminophylline, we deal with it in terms of those who are asthmatic, so you can use it for resuscitation. Then you can also have atropine. Atropine, you can use it for those who come in with organophosphorus poisoning, as well as maybe those who need to be extubated. So you can have such. Then you can also have hydrocortisone. So you know that those who are having maybe severe allergic reactions can benefit from hydrocortisone. So you can have it here in this room. You can resuscitate. Then we have also, you can stock adrenaline. You know, adrenaline works properly in asthmatics, as well as those who are having problems with the heart, so the pulse rate, we can use it. And then also stock dextrose. This is dextrose 50%, okay. So dextrose 50%, we use it for those who are hypoglycemic. We try to resuscitate so that we give them, say for example, alcoholics or those who just maybe have just gone into hypoglycemia. Then have calcium gluconate. Calcium gluconate, we have it. Sometimes we use it as an antidote for magnesium sulfate, as well as those who are gone into hypocalcemia. We can use calcium gluconate. Then we also have sodium bicarbonate. You can have it. So you can just stock a variety of drugs which are acceptable on the emergency trolley. So then the sodium bicarbonate, for those who are maybe have gone into acidosis, we use it. So we can stock these, and you can try to simply go according to what you have as a hospital and see what you can do. Then you have also the razor blades or surgical blades so that you can use them. Maybe you need to cut, there's an emergency, you need to cut their clothing and all that. Then have tranexamic acid. For those who are bleeding, maybe say the severe bleeding or hemorrhage, you can arrest the hemorrhage by giving tranexamic acid. So you can try to give it, okay, but you have to learn how to use it. Then another section here, we have different types of bottles. I'm sure if you're following, we did a video where there were, bottles, how to use the bottles, what you can use for each bottle. So as you are in this observation room or emergency room, ensure that you have all the specimen containers of bottles. Okay, so you can have the plain container like we agreed what to use for, so you can refer to the video. The plain containers. Then we also have the heparin. The green ones are called heparin because they contain heparin as a medium. Okay, so heparin tube, so just read there. Then these, which are purple, we don't call them purple bottles, we call them EDTA because they contain a chemical which we call EDTA-K. Okay, so all these, blood does not clot, but the plain container blood clots. So obviously you get back to the video. Then we also have the fluoride. Okay, this container contains fluoride as a medium or chemical inside because we use it for collecting blood sugar. So you can have all those, plus also the syringes, different types. You can have the 10 cc's, you can have the 5 cc's, 2 cc's, because you are dealing with different types of patients. Then you can also have different types of needles. You can have the these are 21 G's, the one which are green. Sometimes you can have also the 23 G's which are blue. So you can have different types of needles as well. Then you can also do well to prepare your cabinet with fluids, different types of fluids. You can have your normal saline, or we call it sodium chloride. You can have it. You can also have ringalactate. So there's out there. You can have ringalactate. You can prepare your sodium chloride. Then you can also prepare your dextrosaline, which is this one, dextrosaline. So you can have different types of fluids that you can stock there so that you are able to resuscitate your patient effectively. Then you can also have the fluid administration lines, or you call them infusion sets or giving sets. You can have them. Okay, so depending on the name that you're used to, you can have them so that you're able to administer the fluids. Then you can also have the urine bags because you can catheterize that patient, so you need to have a urine bag. So your cabinet can be prepared according to what kind of patients you receive, as well as maybe the setting. Okay, so this is dependent upon the setting. So you can just simply go along and just prepare it very well, because when the emergency room is prepared very well, meaning that those patients who come for observation, or perhaps they are in an emergency or attack, they can be dealt with in one room without you running about. Because if your room is not prepared well, meaning that you'll be able to move out, go maybe to the storeroom, come back from the storeroom, deal with the patient again, go to another room, get something, which will be very tiresome for you, plus the patient might die because you are delaying. So I can just urge you as nurses, just try to prepare the rooms as adequately as possible. Because if these rooms are well prepared, meaning that our work will be done effectively and will reduce on the time that the patient might stay maybe in the observation room, or perhaps even just to reduce on the mortality. So this is Mr. Coco. So if you like the video, please click like, or even if you're not maybe a subscriber, subscribe to Mr. Coco's Nurses Class for more videos, so that at least we improve the nursing profession. And please, for critics, they are acceptable, and also for encouragement, and as well as just to improve what areas we can improve. Okay, so thank you very much for watching, and have a pleasant day.